All right, so we'll talk about the Zilver Venous stent. These are my disclosures. All right, so specification. So it's an open cell nitinol self-expanding design, allows for minimal foreshortening, sufficient lumen expansion without unnecessary force. It's got a low profile system, so it's a 7 French sheath as opposed to some of the other stents on the market. It's a pin-pull delivery system, again, which differs from other stents that are on the market. They have an 80 and 120 delivery system, and they have 4 gold markers on the proximal and distal end of the stent for enhanced visibility. So again, designed for the iliofemoral vein segment. It's available in 40 countries, including the US, Europe, and China. Stent diameters goes from 10, 12, 14, and 16, with stent lengths of 40, 60, 100, and 140. So I'll talk about the 3-year outcomes from the VIVO trial. So it evaluated the Zilver Vena and treatment of symptomatic iliofemoral venous outflow obstruction, 3-year patency, clinical improvement, and stent integrity by the patient subgroups, as categorized as the subgroups were post-thrombotic, NIVL, and acute DVT at baseline. So about 43 were PTS, 33% were NIVL, and 24% were used in acute DVT. These are patient demographics. So on average, about 53 years old, 7% female, BMI about 31, current past DVT is about 68%, current past PE about 15%, bleeding disorders 7%, history of cancer 17% in the whole cohort, and you can see there the breakdowns for each subcategory. And it should be noted that subgroup patient characteristics were aligned with expectations. So those patients with PTS were characterized by a higher number of patients with current and past DVT, and those with coagulopathy. Baseline lesion characteristics, lesion location in the whole cohort, about 214% were common iliac vein, external iliac veins about 52%. Lesion lengths ranged about 98 to 99% millimeters. Stent extension below the inguinal ligament for the whole cohort was about 33%, and total occlusions at baseline were about 22%. Breakdowns for the subgroups are in line with expectations of those. So PTS patients were characterized by a higher rate of total occlusions and longer lesions, and of course, extension below the inguinal ligament. So 30-day freedom from major adverse events rates across all cohorts. For the whole cohort is about 97%. Freedom from adverse events, the performance score was 87%. In NIVL is about 100%, acute DVT 95%, and PTS 95%. 12-month primary quantitative patency outcomes. For the overall cohort, it was about 90%. In NIVL, it was 100%, acute DVT 89%, and PTS 83%. The variation in rates among subgroups is consistent with the expectations based on baseline patient and lesion characteristics. So in the VIVO, they looked at the 3-year patency by ultrasound. So you can see these Kaplan-Meier curves. Overall, it was about 95%, 100% in the NIVL group, and then you can see the other acute DVT and PTS scope. So in 3 years, it's still patent, and they looked at ultrasound as how they looked at patency. They didn't do CTV or any sort of venography. It was just by ultrasound. So had a high 3-year rate of reintervention, about 96% in 365 days, and if you push that out to 3 years, it's about 94%. And then again, if you look down at the breakdown between acute DVT, NIVL, and PTS, NIVL was, NIVL was 100%, 97% for acute DVT, and 92% in PTS. And then as that pushed out to 3 years, NIVL still same at 100%, 92% in acute DVT, and 87% in the PTS groups. So they also looked at VCSS, which is a secondary endpoint in this trial. So the mean change in VCS from baseline was significantly improved for the study cohort at 1 month, and that was maintained through 3 years. So the VCSS score decreased by 4 points from pre-procedure through the 3 years for the whole entire cohort. And same clinical improvement was observed for the subgroups with decreases in VCSS of about 3.6 points in PTS, 4.7 in acute DVT, and 4.8 points in NIVL. We also looked at SEEP classification. So patients were categorized by fewer symptoms according to the SEEP scale. The correlation between time and SEEP classification was highly significant. Patient improvement was observed by 1 month and was sustained through the 3 years. And then similar trends throughout the overall cohort data was observed among the subgroups. So between the 3 subgroups, the same sort of findings. Sustained change in the venous disability score. So they were categorized by fewer symptoms according to the VDS. The correlation between time and VDS classification was highly significant. Patient improvement was observed by 1 month and was sustained through the 3 years. And like the others, the subgroups maintained the same characteristics. So quality of life improvement, looking at the civic score, mean change in civic from baseline was significant for the VIVO study cohort at 1 month, and again, improved or sustained through the 3 years. Civic score decreased by 22.6% from pre-procedure through 12 months and 20.8 points from pre-procedure through 3 years. The same improvement was again observed for the subgroups with decreases in mean civic of 22.8 in PTS, 30.6 in acute DVT, and 17 in NIVL. So I think this is where Zilver Venous is sort of, going to set itself apart from other stents. Fracture was not associated with stent extension below the inguinal ligament. We talked about extension below the inguinal ligament and throughout the day. So 243 patients in the VIVO cohort received 365 Zilver Venous stents. 79 patients, those 33% of those had stents that extended below the inguinal ligament. And then the core laboratory review of available imaging identified no fractures through the 3 years. So I think this is something that sort of sets us apart from other stents, but we obviously have to see how it is and as we use it in real life. So conclusions: VIVO study enrolled a challenging patient population, including patients with multiple disease presentations, like we talked about. The final 3-year results remain in support of the safety and effectiveness of Zilver venous stents by high rates of patency by ultrasound and freedom from reintervention. No stent fractures, and then excellent outcomes were demonstrated among the 3 subgroups.